The hands are nice and dry. I've dried between the fingers really well. I've now proceeded to ask my patient to scoot over just a little bit, Miss Hendricks. Okay, got my clean towel right here. That's fine, please. That's great. Thank you for helping me. And now I'm going to go to this arm the same way. Remember, I'm going to leave this towel here, put this under it, cover this arm, and I'm going to wash this arm, axle, and hand, wash, rinse, and dry the exact same way I did the first one. Now, for my sake of time recording here, I'm moving on to the chest and the abdomen. So, Miss Hendricks, you're still comfortable? This water's still good temperature? I actually have this sheet under here for her, and I'd taken some time to make sure it didn't get wet, but then I decided I need to pull it down out of the way because I don't want it wet. Remember, it's the bath sheet for the patient. So remember, your patient's nude. Your peer partner's going to have a bathing suit on, and Miss Hendricks has a bathing suit on. So, all right, Miss Hendricks, I'm going to wash your chest area. I've already washed your neck, okay? The temperature's still good for the water? Mm-hmm. So now I'm going to wash her chest area. And we're just going to fold it back to her chest area, wash, cover, rinse, and dry. And then go to her abdomen. All right, I'm going to expose her. And over here, you're going to need to move your straps. In the hospital, you won't have any straps. You get those top of those shoulders really good that you didn't get when your arm. Go all the way down, remember? Sorry, don't knock your patient. And then cover them back up. And then I got to rinse her. Remember, I'm standing right here by this bed rail the whole time, so she's never been unsafe. I put the bed down a little bit so I could reach her properly, so in a little while I'll just have to say, hey, is my bed height okay? And I will tell you guys that this water is getting soapy over here, so it's going to be time to change the water, and I haven't used a lot of soap, actually. I've used enough, but not a lot, so just be aware of that. You can't continue to use soapy water on your patients, okay? I'm washed her, I've rinsed her. Now I'm drying her all the way down. Putting her bra strap back in this case, because that feels weird if you don't. In the hospital, you won't come across that. Generally, you don't. Okay, now it'd be time for breast care. That's wash, rinse, and dry that. So what you're going to do is just make your little sheet here, little cover, I should say. And what we want you to do is be able to see the breast area. So when I'm not going to show you, but what you're going to do is have to wash the breasts farthest away from you, okay? And you would actually lift the towel like this so you can visualize the breast itself. From this way, you wouldn't want to do like this because the patient can then see your hand washing their breast. That's why you always grab from this edge, okay? So you can see what you're washing, but the patient can't actually see their breast while you're washing. So we're going to start for this one, start in the center of the breast, the areola, and go areola out in a circular motion all the way around the whole breast tissue. Make sure you get under the breast tissue, between the breast tissue. If it's a larger breast, you're going to have to pick the breast up with this cloth, and make sure you get under there, wash, rinse, and dry both areas really well, and go make sure you go to the sheet on that too. Wash, rinse, and dry, because there could be skin breakdown under the breast areas or some yeast buildup if patient's larger or sick. All right. So now we're going to abdomen. We've done that. In the peer checkoff, you talk through that. You don't actually wash their breast, okay? You talk through that. Now that I've washed her breast, I'm going to pull the sheet down so I can reach her abdomen. And I'm trying to do this so I never expose my patient. Never expose my patient. All right? So these side rails are getting on my nerves a little bit. I need to go down here. Can't work over your side rails. Can't work between your side rails. You need to work with your side rails at all times, okay? So when you're in the hospital, you need to wash the abdomen from the mons pubis or the symphysis pubis all the way to that area. Here, we're going to wash the top of your peer's bathing suit, okay? But you make sure you include their umbilicus. You just pull your table with you the whole time. Now, after this abdomen, I'm getting her some new water. It's getting a little chilly too. Not cold, but I can tell the water may need changing. All right. All right. I'm going to go sheet to sheet. Okay, Miss Hendricks is small enough for me to do sheet to sheet with no problem. Okay, covering her back up. And I'm going to rinse it. I'm going to do umbilicus, or you can do it together. Probably could do it together. It'd be simpler and easier. We're going to do our umbilicus so I don't forget it. Gotta go in there really good and get it clean. And now I'm rinsing. Notice it might not be in perfect order, but you go back and do what you're thinking about, and it's okay. And remember, in your bath, you're not talking, you're doing it. You don't have to talk unless your instructor asks you a question, but you should be communicating with your patient. Miss Hendricks, are you okay?
Okay.
You're not too cold or anything?
I know.
Okay.
It was warm in here earlier.
Okay, I'm making sure your umbilicus is really dry and got all the soap out, or really rinsed and got the soap out. All the way down. Got to find you. Miss Hendricks, do you feel dry?
Mm-hmm.
Okay, so now I'm going to actually pull her sheet up some to give her some more privacy here. Okay, now I've gotten the upper body. So now I'm going to her legs. And notice she pulls her arms out. I'm fine with that. She's fine with that, okay? You can actually leave this towel here for your liking on some patients. You have a choice now. You can put the gown on, but a lot of instructors don't like it on this point because if you get it wet, they're going to ding you for it. So keep them covered. If they're very cold, you can apply the gown, but remember, do not get it wet. Now, pericare is a whole separate ordeal. I'm not going through that now. Remember, at any instance, if you come into the room and your patient's soiled, like when we did bedpan here, we cleaned her up and did pericare, you have to take care of that first. But at this point, I'm not doing pericare. I'm going straight to her legs like your checkoff. In the hospital, you may have to go to pericare with your disposable things, but never any of your basin at this point, okay? So now I'm going to do your legs, Miss Hendricks, and I'm going to see how many towels. These towels are fairly small.
Are you going to get me water?
I am going to get new water, but I was going to drape you.
Oh, okay.
Is that okay?
That's fine.
She wants me to get new water, and that's fine. We talked about that. Her water's getting cool, and she's been washed, and she's fairly young and healthy, and she's cool. So you can imagine somebody who's 70 or 80, okay? Now you have a choice for the draping. You can do one towel here. You can take this one at this point and put it over here. Or if your towel's large enough, which these are the lab towels, the ones that you're breaking from home will be a lot larger, and you can just use one towel and wrap it, okay? So your choice on that. And when you go to wash it, just slightly bend their leg, okay? And then you can wash there. If they can't hold their leg up, you'll have to hold it for them, okay? All right, Miss Hendricks, I'm gonna make sure I get you some new water. Be right back.